Hey guys, and welcome back to my channel. In today's video, I will be taking you through the competency-based test practice questions provided by Pearson VUE, although it is divided into two parts, the part A being the numeracy, that is drug calculations, and the part B being the clinical aspect. So the clinical aspect has to do with your nursing knowledge and how to relate with patients and other bits and that of clinical practice. So we have three parts that have been provided by Pearson VUE for numeracy practice questions and one part for just adult nursing. So in this video, we'll be going through all of them and I'll be giving you some remarks, how to go about those questions. So if that sounds like something you are interested in, please do make sure to watch this video up until the very end. Okay, welcome and welcome back. If you're seeing me for the very first time, hi, my name is Samuel. I'm a registered nurse and I love to teach. This is my YouTube channel. Please like, comment and subscribe. So let's go to the part one of numeracy right now. The instruction says here, for example, if the correct answer to a question is 5 ml, then the following responses would be marked as incorrect. 5 ml of water, 5 milliliters, 5 mils, 5 ml. So it should be 5 ml just as it's written. So sometimes it's not that you are not getting it correctly, but you are just writing the answers the wrong way. Please make sure to read all the instructions before you go. So once you've read the instruction, of course, you go ahead, select yes. So what is the volume that has been drawn up into the syringe? Please use the correct unit and write your answer to 1 decimal place. Always take note of the instruction. So this is 6.5. Now we have not been given a unit, so we're going to write it ourselves. What is the volume that has been dispensed? Please use the correct unit. 20 ml. A patient has been prescribed 2 liters of 0.9 sodium chloride. What is the volume in milliliters? That is 2000. Oh, you see, I just made a mistake. Now, all I just had to do was 2000 and needed not to put the ml because it's already there in your answer. So thankfully, it did not allow us to put in that. If not, the answer would have been wrong. A patient has been prescribed 0.6 gram of ibuprofen. What is the dose in milligram? That is 600. Again, gosh. A patient has been prescribed 300 milligram of phenytoin. How many tablets should be administered? Now you can see on the packet that it says 100 milligram tablets. That means one tablet is 100 milligram and your patient has been prescribed 300 milligrams. So what do you have to do? 300 divided by 100, which gives you 3. If you do not understand how I was getting some of the answers, please do make sure to leave your questions in the comment section and I will answer them, okay? A patient has been prescribed 1 gram of carbocysteine solution. I think carbocysteine is for, I can't really remember what it's for, but we use it here. Let me just search quickly. What is carbocysteine prescribed for? Yes, it is prescribed for treating and preventing respiratory diseases associated with thick mucus. So people with pulmonary diseases such as COPD and all, or people that generally produce thick mucus, they are prescribed carbocysteine and it helps them get better. So 1 gram of carbocysteine is prescribed and we have 200 milligram per 5 ml. So in order to get 1 gram, we need to get, that's 200 milligram into 1000 milligram. That's how many 200 milligram is in 1000 milligram, which is 5. So we are going to give how many mil? So I don't want this video to be too long, so that's why it seems like I'm a bit, these are basic mathematics. So we have 200 milligram in 5 ml. That means we have 1000 milligram in x. And what is the answer if you cross multiply and everything? Our answer should be 25. So 25 ml. Take note of how I'm putting the units, ml, just like it's written in the question. So a patient has been prescribed 100 milligram of phenytoin suspension. What volume should be administered? Please use the correct unit. Okay, a patient is prescribed 100 milligram and our bottle comes in 250 milligram in 5 ml. So that means 1 ml is 50 milligram. You know how I got that, right? Divide both sides by 5. And then since 50 milligram is equal to 1 ml, So how many milligrams will give us, how many mils will give us 100 milligram? That, since we have 50 milligram in 1 mil, 50 times 2 will give us 100. So we are going to give 2 mil. I hope you understand. A patient has been prescribed levetiracetam suspension. It is something that is used for seizures, people that have seizures. A patient has been prescribed levetiracetam suspension at a dose of 10 milligram per kg. So this person weighs 70 kilograms. What volume should be administered? That means the person is having 10 milligram per kg. That's 10 times 70, which gives us 700 milligram. So this suspension comes in 100 milligram per 1 mil, and we have to give the patient per kilogram, which gives us 700 milligram. So how many mil are we given? It's simply 1 times 7, which is 7 milliliters. A patient has been prescribed 60 milligram of flupentazole decanoate. What should be drawn up for the syringe? Please use the correct drainage. So this is very simple and straightforward. 20 milligram is in 1 mil, and we have to give 60 milligrams. So that means 20 divided by 60, which is 3. A patient has been prescribed 4 milligram of diamorphine hydrochloride. These are like medications for end of life, people that are dying. So like, just to make them, we have medications to make them pain free, we have medications to get rid of their excess secretions, we have medications to sort of relieve them of agitation and all sorts of things. So a patient has been prescribed 4 milligram of diamorphine. What volume should be drawn up for the syringe? And we have 5 milligram in 1 mil. Now this one is a bit tricky. You know what, let's just do it like a maths calculation. Since 5 milligram is in 1 mil, how many milligram will be in 4 mil? Do it, cross multiply, and tell me your answer. Okay guys, so my answer is 0.8 mil using that method that I told you guys to do. I think there will be calculators on your computer, because you'll be using your computers, of course, so you have nothing to worry about. And your answer already says in 1 decimal place, so that should give you, your instruction says in 1 decimal place. That should give you like a sort of like nodding, like, okay, oh, this thing is going to be in a decimal answer. A patient has been prescribed pethidine hydrochloride at a dose of 0.5 milligram per kilograms. Your patient weighs 90 kilograms. So that means this person is already due for 45 milligram. So what volume should be drawn up for the syringe? So this person is to take 45 milligram, and it gives us 50 milligram in 1 mil, and the person is to take 45 milligram. So let's use the same method again to calculate it. 45 divided by 50, 0.9 mil. I hope you understand this, guys. I really do hope you understand. So what I did was this times this, it gave me 45. Then I brought this here. So 45 milligram is equal to x times 50, 45 times 1, divide 45 by 50, and that's how I got this. I really do hope you guys understand, but if you don't understand, I may have to offer a master class for this. It will be very affordable, but I really do hope that you guys understand, because I'm not doing this because I want to make money from a master class. I just want to help you guys to be able to learn these things by yourself without much stress. So the next question says, at what rate should you set the infusion pump to run? Okay, so we are to set up an infusion of 400 ml to run for 5 hours, and it's starting by 8. So all you just have to do is 400 divided by 5, because the time is asking like how many ml per hour. 400 divided by 5 gives you 80, so that's 80 mil. I don't think you need up to 30 minutes to finish this part, to be honest. So the same thing goes for this again. 1000 mil in 6 hours. At what rate should you set the infusion pump to run? Give your answer to the nearest whole number. 1000 mil, you've got 1000 mil to run for 6 hours. Let me do the proper calculation. That will be 1000 divided by 6. Okay, 16 16.67. All right, so your calculator would just be somewhere like this, 0.67. So give your answer to the nearest whole number. So that will be 167. Another question says this is a blood, 800 ml, and to give for 5 hours. So how many ml per hour would you run? That's 800 divided by 5. So 800 divided by 5. Okay, 160. Now we have gotten to the most tricky part. Okay, so all you have to do here is to fill up this. Now note that anything that is input is plus, anything that is output is a deduction. So what we have to do now is to add up all this input. So let's get our calculator. How many 125 do we have? 125 times 6 plus 150 is 300 plus 100. Everything gives us 500 plus 500. That's 1,250. So total input is 1,250 ml. Because if you read the instruction, it says if the patient has gained, so total output equals 910 ml. So we are going to subtract this from each other. So our final answer, don't forget the person gained, so it will be plus, what was that again? 340. I can't remember if there's supposed to be plus or minus in this total and total input and output, but let's just see, guys. We got everything, so you guys can see that it is very easy, honestly. The first question says, what is the volume that has been drawn up into the syringe? Please use the correct units and write your answer to 1 decimal place. Again, instructions are a very big thing. Now you can see that over here we have 1.5, which means this is 1.6, this is 1.7, and this is 1.8 ml. So we're just going to scroll down and write our answer, 1.8 ml. Now there's no ml here, so we are permitted to put it. Now next, what is the volume that has been dispensed? Please use the correct units. This is already given to us. It says 10, so we're just gonna go ahead and put 10 ml. You can see how I'm putting my ml just like it's written on the dispensing pots that we're seeing in the picture. Next, a patient has been prescribed 0.2 milligram of digoxin. What is the dose in microgram? Now, how many milligram make micrograms? I think that is 1 milligram is equal to 1,000 micrograms. 1 milligram equals 1,000 micrograms. So that basically 200 micrograms. Because you already have a unit, you don't need to put your micrograms in there. A patient produces 1,250 ml of urine in 24 hours. How many is that in liters? That is 1.25. Anyway, I'm just gonna flag the ones that I'm not too sure of for a review later. So a patient has been prescribed 800 milligram of aspirin. How many tablets should be administered? And each tablet is 200 milligram. So that's basically 800 divided by 200, which is 4. A patient has been prescribed 100 milligram of amitriptyline hydrochloride solution. What volume should be administered? Please use the correct units. Now we have 25 milligram in 5 ml. That means 5 milligram equals 1 ml. So since 5 milligram equals 1 ml, how many milligram will be 100? So it's basically just calculation. You just go ahead and calculate it. Okay, so let's just do it like this in order to save our time. 25 milligram equals 5 ml. 100 milligram then equals how many ml? That's x. So how many 25 will be found in 100? That is 4. So 4 times 5, which is 20. So our answer is 20 ml. A patient has been prescribed 600 milligram of cefadroxil suspension. What volume should be administered? Please use the correct units. Again, 600 milligram of what volume should be administered? Now 250 milligram equals 5 ml, so which means 50 milligram is 1 ml. I hope you understand how I got that. Divide every area by 5. So basically, 250 milligram equals 5 ml, 600 milligram equals x. You just divide both sides and your final answer should be 12, making 12 mil. So that's how you should basically do it all in order to get your answer. I hope you understand all of this. So I won't have to go this deep in other questions. Again, take note of your time so that you don't waste too much time on a singular question. Now, a patient has been prescribed phenytoin solution at a dose of 1.8 milligram per kilogram, and the patient weighs 100 kilogram. What volume should be administered? So that is 100 times 1.8, which gives us what? 180 milligram. So how many 30 can be found in 180 milligram? That is 6. So 6 times 5, because 30 milligram is 5 mil, right? So that's 6 times 5 gives you what? 30 L. A patient has been prescribed 36 milligram of codeine phosphate. What volume should be drawn up for the injection? Please use the correct units and write your answer to 1 decimal place. So we know this one is in 1 decimal place. Again, we're going to use the same method that we used earlier for the previous questions. Now, do not be scared and think, oh, I won't have a calculator or something. No, don't worry, you will be given all of that. It's a computer stuff anyway, so there's calculator available in your computer, okay? And I think you will be given like a sheet of paper or something, or you can ask for it, and a pencil as well. So let's go ahead and answer this question. Okay, so 36 milligram is what we are given, and we have 60 milligram in 1 mil, and this equals x. So what we are basically going to do is to divide 36 by 60. So 3 here, 6 here, 6 here, 10. So your answer is 0.6 mil. I hope you understand that. So your answer should be 0.6 mil. Now let's just go ahead and input that in our... A patient has been prescribed 8 milligram of metoclopramide hydrochloride. What volume should be drawn up for the injection? Please use the correct units and write your answer to 1 decimal place. So if 5 milligram equals 1 mil, 8 milligram equals dash. So your answer would be 8 divided by 5, which equals 1.6. Now, I feel like these are like basic calculations, all these parts, and I don't need to go in too deep. Or, I just hope you understand, really. A patient has been prescribed tramadol hydrochloride at a dose of 1.5 milligram per kilogram. Tramadol is for pain relief. Your patient weighs 80 kilogram. What volume should be drawn up for the injection? Now, we are not given like the actual dose this person should take. So the first thing you have to do is multiply 80 kilogram by the dosage, which is 1.5 milligram per kilogram. And that is basically 120. So we have 50 milligram in 1 mil. So if 50 milligram equals 1 mil, 120 milligram equals dash. And that gives us 120 divided by 50. I hope you understand. So what is 120 divided by 50? That is 2.4 mil. At what rate would you set up the infusion pump to run? Now this is basically, flow rate or something, how to set up infusion. Yeah, so this one is basically multiplication. You have or division rather. Let's see, you have 750 mil to run for 6 hours. So basically what you have to do is to carry 750, the volume, and divide it by the hour given. That is 750 divided by 6, which gives you 125 mil per hour. Now in this aspect, you just need to put your 125. You don't need to go deep, because you already have the unit. So let's go to the next question. I don't even know which question are we in now. At what rate would you set up the infusion pump to run? Give your answer to the nearest whole number. Now this one, we have a volume of 700 divided by 8 hours. So what you have to do is again to divide. Calculator, 700. So we have 87.5, and to the nearest whole number we have 88 mil per hour. Again, similar thing, 800 mil divided by 10 hours. We have basically 80 mil per hour. Now, we've come to the bit of interesting part, which is the balancing of fluid chart. This person has had sodium chloride, 500 mil. So what you have to do is to calculate all of the inputs, put it on one side of the total input, calculate all of the outputs, put it in the total output, and then when you balance it, if the input is more than the output, then your answer should be in plus. But if the output is more than the input, then your answer should be in minus. It is very simple. So let's just go ahead and do this one as well. I don't know, should we put ml? Yeah, let's put ml. That is output of 505 mil. So balance gives us what? 950 minus 55, which is 445 ml. So we have an input of, again, the instruction is already given how you are supposed to write it. So we have a balance input of plus 45 and we got everything. So you can see that this is very simple, and yeah, you can do this. It's not so difficult. So let's review the flagged ones, the ones that I flagged. Okay, I mean, there's no need to review it. It's because I was doubting anyway. So if you liked it, make sure to give it a thumbs up, comment, like, share, and subscribe. Share to a friend who you know that would need this, and I hope to see you in part 3. Okay, let's go to the first question. What is the volume that has been drawn up into the syringe? Please use the correct units and write your answers to 1 decimal place. This is very straightforward. We have where the fluid is stopped at 0.8. So we're just going to scroll up and put in 0.8 ml. What is the volume that has been dispensed? Please use the correct unit. This is 15 ml. A patient has been prescribed 0.8 liter of gelofusine. What is the volume in ml? We all know that 1000 milliliter is 1 liter. So 0.8 liters times 1000 gives us what? 800 ml. Isn't that too much though? A patient produced 650 ml of urine in 24 hours. What is the volume in liters? That is 0.65 liters. Please take note that where the units have already been provided for me, I am not putting them in at all. A patient has been prescribed 375 milligram of vancomycin. How many capsules should be administered? So we have each capsule to be 125 milligram. So we're just going to carry 375 and divide it by 125, which I believe should be 3. Yeah. A patient has been prescribed 15 milligram of nitrazepam suspension. What volume should be administered? Please use the correct unit. So 2.5 milligram is 5 ml, which means that 15 milligram will be how many ml? You just sort of do some cross multiplication and arrive at your final answer. So I have done mine and I have arrived at the ml, and I'm just going to put that in right now. A patient has been prescribed 450 milligram of ampicillin suspension. What volume should be administered? Please use the correct units. 125 milligram equals 5 ml. So how many gives us 450? So again, we just go ahead and do cross multiplications. Now I have done my calculations and I have arrived at 18 ml. Our next question says, a patient has been prescribed erythromycin suspension at a dose of 1.5 milligram per kilogram. The patient weighs 100 kilogram. So what you have to do is to multiply 1.5 times 100, and the answer is 150. So how many ml should you give? Since 125 milligram equals 5 ml, that means 1 ml equals 25 milligram, and we are supposed to give 150 milligram. So that means we are given 6 ml. If you don't understand how I came around this, you can just go ahead and do cross multiplication as well. A patient has been prescribed 400 milligram of zuclopentazole decanoate. What volume should be drawn up for the injection? Please use the correct units. We have 200 milligram in 1 ml, and we are to give 400 milligrams. So that's basically, 2 of it, yeah, times 2. So we're giving 2 ml. A patient has been prescribed 60 mg of haloperidol decanoate. What volume should be drawn up for the injection? So we are to put our answer in 1 decimal place. And yeah, all you have to do is to just go ahead and divide 60 by 100 in this kind of situation. So when we do that, we should have something like 0.6 mil. Next question says, a patient has been prescribed pethidine hydrochloride at a dose of 0.5 milligram per kilogram. The patient weighs 88 kilogram. Now, what volume should be drawn up for the injection? So all you have to do is to multiply 88 kilogram by 0.5, which gives us 44 milligram. Now we have 50 milligram in 1 meal. So just like the previous question, you just go ahead and divide 44 by 50. So our answer says 0.88 mil, and we have here that you are to give your answer in 2 decimal places. So of course we know that it's 0.88 mil. Are you wondering, like, how am I supposed to give 0.88 mil? Yeah, if it's me, I would probably just draw up to 0.9, not up to 0.9 completely, because when you give, a little bit remains in the syringe anyway. Now we have come to the fluid rate charts. So at what rate should you set up the infusion pump to run? Give your answer to the nearest whole number. We have a fluid volume of 800 to run for 6 hours. So basically what we are going to do is to divide 800 by 6, and that should give us 133.33, and the instruction is to give your answer to the nearest whole number. So our answer is 133 mil per hour. Again, take note of your instruction and take note of your units. At what rate would you set the infusion pump to run? 1000 divided by 5. I don't need to calculate that one, you know it's 200. 200 mil per hour. So we have another one, 300 mil to run for 3 hours. Again, 100 mil per hour. So some of these questions can be very simple, honestly. Now we have the fluid balance chart. So what you have to do is to calculate your input, calculate your output, and then subtract them. If your input is greater than output, then it is plus. If the output is greater than input, then it is minus, which means that the person actually has lost fluid than gaining fluid. So it's as simple as that. I will just go ahead now and add everything up, and I'll put them here. So I have calculated all inputs to be 750 mil and all outputs to be 680 mil. And then I am now going to subtract them from each other, and my answer is 70 mil. And the input is greater than the output, which means that the person gained fluid. So I'm just going to go ahead and put plus 70 ml. Please take note of the spacing, how I'm spacing it, because this exam is going to be marked by computer, not a human being that will know that, oh, you just didn't write it well, how the computer is programmed to mark it. I hope that makes sense. So let's go ahead now and see. Yeah, we got everything. So I hope you understood everything, and that is it with this video. If you enjoyed it, please do make sure to like, comment, and subscribe, and check out the clinical questions practice tests as well that I will probably be uploading very soon or already have uploaded. So until next time, bye. Anyway, I'll be taking you through the clinical aspect of CBT. CBT simply means competency-based test, and this is the test that you are required to write if you are planning to come to the United Kingdom to practice as a registered nurse. So this clinical aspect in your exam consists of about 100 questions, I think, and you are required to pass to some extent, I'm not sure, 50%. So we have a practice questions of 50 questions, and we are going to try as much as possible to answer them and explain everything to you in a way that you would easily understand. So to make things easier for you, if you are someone who loves reading voluminous books, you can get ahead to get this Royal Marsden Clinical Nursing Textbook. It will greatly help you in your journey of relocating to the United Kingdom to practice as a registered nurse. And I believe that some of the questions that you find in this competency-based test are taken from that textbook. So without wasting much time, let us go into the practice questions. So as you can see on the screen, you would be given some instructions. These instructions are vital because it's not just about knowing the correct answer, but writing it in the right way, because your questions will be marked by a computer. Always remember that. These practice questions is to show you the time on the exam, how things go, you know, just basically to prepare you for how the exam looks like. Which of the following describes a quantitative method of research? Choose the correct answer. So quantitative means what? Something that can be quantified. That means like numbered. So A says collecting people's views and opinions. B says exploring a phenomenon by interviewing participants. C says reviewing published research. D is a collection of numeral data. We'll be choosing collection of numeral data. So if you are in need of calculator, all you just have to do is to click here and you would see your calculator right here. Your calculator is just by the side. And then you can click on this objective and it will like give you a hint of what that question is aiming for. Prioritize people, practice effectively, preserve safety, promote professionalism and trust. D is our answer for this question. When caring for a patient who is Jehovah's Witness suffering a severe hemorrhage, what do you consider? Choose the correct answer. They are not to receive blood or blood products. They are not to be resuscitated. They are not to be sedated. They are to be cared for by professionals who are JW. They are not to receive blood or blood products. When caring for a patient who does not speak English, how do you obtain information from the patient? Choose the correct answer. A. Ask a family member to translate. B. Use a face-to-face or online translator. C. Ask the patient to draw pictures. D. Find the information you need from medical notes. Use a face-to-face or online translator. Okay, so the reason why I think we are not to choose family to translate is because some things are meant to be confidential and probably your patient does not want the family to know. So that is why I chose that answer, that get a face-to-face or online translator. Okay, the next question says, when a drug error occurs and the patient has been assessed for any harm, what is the next priority? Choose the correct answer. A. Inform the patient of what has happened. Continue to administer the next dose. Continue your drug round. Call the patient's family. I think it should be call the patient's family. So if you are not sure about any question, you can always flag for review. To be honest, I don't think I'm going to do well in these questions because the HPV vaccination prevents which disease? Is it ovarian or cervical? I would go for cervical cancer. No, I think I chose the wrong one. Oh dear. Which of the following professions are specifically trained in smoking cessation? Definitely a hypnotherapist, I think. I'm not so sure, but I know that a chiropractor has to do with bones, or dietitian has to do with nutrition, pharmacist has to do with whole of medication. So I'll choose that one. And again, you can flag for review. Okay, the next question says, which of the following diseases is notifiable to Public Health England? Choose the correct answer. You know what, don't be too bothered if you get the right answer or not. So for this one, we can just go ahead and choose Clostridium, no, communicable diseases, human papilloma virus. I'm doubting between that or influenza, whole of medication. So I'll choose that one. And again, you can flag for review. Okay, the next question says, which of the is notifiable to Public Health England? Choose the correct answer. Don't be too bothered if you get the right answer or not. So for this one, we can just go ahead and choose Clostridium, no, communicable diseases, human papilloma virus. I'm doubting between that or influenza. Which of the following is a health visitor's responsibility? Choose the correct answer. A. Assessing speech and language development. Administering immunizations, giving emergency first aid and treatment in a crisis. That's the correct answer. What are the common complications of uncontrolled blood sugar in diabetes? Ketones. Choose the correct answer. Renal failure, joint pain, urinary incontinence, no. Retinopathy, yes. Peripheral, yeah. Renal failure. Okay. A doctor requests a lactate test to be taken from a very unwell patient. What type of sample is taken? That would be blood gas. Yeah, I'll go with blood gas. On scale 2 of the news 2 chart is used for which patient group? Okay, so the scale 2 is this. Now, our question says the scale 2 news 2 chart is used for which patient group? So, A, those who have been exposed to carbon monoxide. B, those receiving intravenous therapy. Those with carbon dioxide retaining patients. So the next question says, patients with chronic pain conditions are screened for which of the following? Choose the correct answer. A, schizophrenia. B, low mood and depression. C, coronary heart disease. And D, bowel cancer. I think this will be our answer because it's the only thing that I can see here that is relating to pain. Which of the following groups has the highest rates of suicide? It's men. I am 100%, no, 99% positive that it's men. So I chose men. Next question says, a patient presents with a productive cough, low saturations, high respiration rate, raised lactate with news 2 of 9. Which of the following does this indicate? I think it indicates chest sepsis. Yeah, I'll go for chest sepsis. Prior to surgery, how long are oral fluids withheld? Please choose the correct answer. 2 hours. Next question says, what group of drugs are used in patient-controlled analgesia? Opioids, of course. Next question says, patients who are put on furosemide are warned of which common side effect? It's polyuria, because furosemide makes people urinate often than usual. You have a patient who is choking. You have administered 5 back slaps with no success. What is the next step? Choose the correct answer. Give 5 more back slaps. No. Start a basic light stop up. No. Give 5 abdominal thrusts. After then you go and you hold them like this to their, and then you pull thrusts. You are caring for a patient who has a stoma formation and they are ready for discharge. What advice do you give the patient? Choose the correct answer. Use perfumed soaps to aid odor control. B, wait until the bag is full before changing it and clean with soapy water. C, keep the area moist when changing the bag, advocating the use of oils to help the surrounding skin. C, clean with water, trying to keep fecal fluid away from skin to minimize irritation. I'm just going to choose this, but I am not sure. What is the responsibility of an occupational therapist? Choose the correct answer. Supporting people whose family may prevent them from completing their normal activity now, reviewing and adjusting now, assessing injury or damage in a patient. It's supporting people whose health may prevent them from completing their normal activity. Our next question says, whose role is it to lobby the government to support nurses and make positive change to the profession and working conditions? This one is obviously the nursing unions, but then I don't know about the hospitals in the UK, how they are, but I hope I'm right. What does it mean to performance manage an employee? Choose the correct answer. A, developing a person to fulfill the expectations of their role. B, when someone is being dismissed from their workplace. C, when a person is promoted. D, when performance is exceeding the expected level. No. Developing a person to fulfill the expectations of their role. When running a ward or unit, which of the following is the priority at the start of the shift? Choose the correct answer. A. Make sure a doctor is on the ward. C. Check the staff numbers, match patient acuity, give out breakfasts, calling and updating. No, I think it should be to check the staff numbers. I just hope I'm right. We're always short-staffed anyway. When supervising a student nurse, when do you deliver feedback? A. Continuously throughout the placement. B. At the end of the placement. C. Feedback is provided by the university, so you don't need. It should be at the end of the placement. What is a whistleblowing policy? So whistleblowing is like, maybe I work for a company now, and that company, they sometimes do some terrible. They sometimes do some terrible things, like things that are not legal, you know, especially towards patient care. Maybe people are beating residents or patients, and of course I know that this is not right, but I can't really say because I'm a worker here and I don't want to lose my job and I just want to protect myself. So the act of me finding a way to get this information out is whistleblowing. But now some companies have whistleblowing policy. I believe most companies should have it. So this is what this question is all about now. A policy that helps employers manage staff, a policy that guides staff on raising concerns about safety and practice. I think it should be this one. So, when undertaking research, what is the first step? Oh, I think it should be selecting a topic because you have to choose what to work on first, right? So I will just go with that. What is the main purpose of root cause analysis? A. To ensure that reoccurrence is avoided, to provide data about the incidents to the Department of Health, to assess if those involved require compensation, to identify who was responsible for the incidents and performance manage them. I'm just going to go for this. Who will notify an emergency department that a major external incident has occurred? Choose the correct answer. The answer should be the nurse in charge of the department. When noticing that a colleague is suffering from low mood and depression, what actions should be taken? Choose the correct answer. Been implemented to ensure that nurses are fit to care holistically for patients with a variety of conditions. Choose the answer. Ensuring students have maths and English, preceptorship trainings. Yeah, it should be preceptorship trainings. Who is in attendance at a child protection case conference? Oh, I'm not so sure of this, but I think it should involve the family, health, and educational social services. What could help a nurse understand the preferences of a patient with dementia? Please choose the correct answer. So dementia is also known as Alzheimer's disease, and this is where people basically forget who they are, they lose their memory. Sometimes they wander around, sometimes they say irrelevant things, or they just say gibberish. It's something that is very common in the UK. I think it is one of the leading causes of death in the United Kingdom, and it affects a lot of the elderly in the United Kingdom. So if you end up choosing to work in a care home, you will be seeing a lot of these because that's what makes most people end up in a care home. Okay, so back to the question. The answer should be, this is me document, because this is a document that you will see the picture of the resident. It will tell you their name, their date of birth, what they're like, their music, their type of their food preference, just a lot of things. You could want to say the handover sheet, but no, it's the this is me document. So next question says, who should be notified when attending hospital with a school child aged 8? Choose the correct answer. This question is a bit tricky, so I'll choose school teacher and flag it for review. So let's go to the next question. There is a requirement to increase nursing staff on a ward due to an increase in patients' demand. What steps are taken? Choose the correct answer. Go directly to Human Resources, HR, and ask them to recruit. Ask the team to increase their working hours. A business case is written to increase nursing staff numbers. Reduce the number of patients to the no. I don't think our answer can be A, so I'm just going to go for C. Now the next question. When failing a student for professional values, what steps are taken before the end of the placement? Choose the correct answer. Contact the university and get them to inform the students they have failed the placement. No steps required as long as the fail is documented clearly in the assessment. Inform your line manager so they can inform. I think I'll just go for this last point, which is a midpoint interview where you are able to give feedback and allow students to develop an action plan to achieve. Okay, I think because I don't work in the NHS, I won't be too sure of this. Because we answered a question earlier that said, when should you give feedback? Anyway, motivational interviewing is best described as such a method to use to encourage people to adhere to discharge advice. A tool used in appraising staff development, a tool used in peers no, a method of assisting people with health behavior change. I'll just go with A. What is the best method of delivering advice to patients with a new diagnosis of a long-term condition? Ensure there is a range of materials available and present for the patient to take home after the consultation. Advise the patient to look up any questions? No. Give all information? No. Information and diagnosis given? No. I'll just go with A. ANTT simply means aseptic non-touch technique. Antiseptic? No, it's aseptic. Which of the following is not considered to be an aerosol generating procedure? What's an aerosol again? Okay, so an aerosol is like tiny droplets, and I think we'll just go with assisting of medication, since that is the only thing that does not really like involve you like bringing out blood or bodily fluid. I think aerosol can just be like bodily fluid in that aspect. A wheeze is commonly heard on auscultation in which of the following conditions? That should be pneumothorax, or is it pulmonary edema? To say pneumothorax. Emetemesis simply means blood in the vomit. When caring for patients at the end of life, a family reports that they are concerned that the patient is suffering from dehydration. What action is taken? Advise the family that this is a common symptom that is unable to be resolved. Ask the family to encourage oral fluids more. No. Start measuring the urine output to diagnose that? No. Ensure? No. So the only thing is that we can advise the family that that is a symptom. But I'm not sure of what stage of end of life this is, because when somebody is at the final stage of end of life, they tend not to drink anymore, and they can't eat anymore, so you can't really push down fluid. So that is why I'm selecting that option which I've selected. A person over the age of 70 with a respiratory disease is encouraged to obtain which of the following immunizations? Flu vaccine, I think. What medication is given to someone to prevent the long-term disabling effects of acute ischemic disease? Like Zane. It's a blood thinner. When discharging an adult with an acute wound, who is the patient referred to for wound care? That should be the district nursing team. District nursing team, they are the people that come to homes to care for people. They are like they go around homes. They don't have like a hospital. They will nurse people in the community. Research suggested that the majority of in-hospital cardiac arrests were avoidable. This led to the introduction of what? News score. News score is like a warning. It's like a tool where you assess somebody based on the symptoms they are presenting, and they know if you are calling an ambulance or not. If I get a picture, I'll put it on the screen somewhere around here for you to see. So it's a tool, and there are so many tools here like Abbey Pain Scale, Bristol's tool chart, a lot of things like that that is used in nursing in the United Kingdom. Okay, I thought we answered this question earlier. Okay, this is me document is implemented to aid in care for which patient group? Patients with dementia. Oof. So we have come to the final. We got 16 questions wrongly. That means we passed how many? 34, which is not too bad because I have not practiced this. I just came back from work now, and I just opened this to make this video and to show you guys how this is done. And I've not read something in a long time. So let's just review the incorrect. When a drug error occurs and the patient has been assessed for any harm, what is the next priority? Choose the correct answer. Okay, it should be to inform the patient of what has happened. Oh, so I got that one now. So number 7 now says, which of the following professionals are specifically trained in smoking cessation? So I'm just going to choose a pharmacist now and see. Let's go back to review screen. Okay, So that one is correct as well. So let's check number 8 now. Which of the following diseases is not... I think this should be mumps. So if you think you can easily do this as well, and that's why I'm just showing you guys, I don't know it all. So let's just do it together. So the next one, which of the following is a health visitor's responsibility? Should probably supporting the physical and emotional growth of a child. Yes, correct. So number 13, patients with chronic pain conditions are screened for which of the following? Probably coronary heart disease. Well, I didn't even think of this question very well. No, low mood and depression. Yes, that is right. So the next question that is incorrect says, when supervising a student, when do you deliver feedback? Continuously through the placement. That should be our answer, yes. Then the next question, I think this should be the ambulance service lead, if it's not that one. Yes, that is right. I think I'm being too fast. I'm so sorry. Please just pause if you think I'm being too fast. Okay, so the next question says, what has been implemented to ensure that nurses are fit to practice? New pre-registration education standards, I think. Yeah, so this one should be the school nurse, who should be notified when attending hospital with a school child. I think that should be the school nurse or local children's center. School nurse. Yeah. So the next question says, this one, did I even think about it? So we got that right. This one I'm not so sure. I'm just going to choose one of this. Yeah, motivational interviewing is described as a tool used in appraising staff for development, I think. 5 incorrect. Okay, we got that right. Which of the following is not considered an aerosol? Which one should it not be? Performing oral hygiene, maybe? So the answer says blood transfusion, but I'm not too sure about this. So please make your research about that and comment in the comment section, because I'm a bit confused about that question as well. Yeah, I knew this would be... Yeah, acute asthma for that one. So the case of dehydration, yeah, I did see about this question earlier. Okay. So the answer is to ensure subcutaneous fluids are commenced. Okay. Then the final one. When medication is given to someone to prevent long-term disability, thrombolysis. And that is it, guys. We have finally cleared all that we got wrongly. So I just hope that I have been able to put you through all of how to do the adult nurse competency practice questions provided by Pearson VUE. If you enjoyed this video, make sure to give us a thumbs up, like, comment, and share, and I hope to see you in subsequent videos. So until next time, bye.